So that depends on the person, always. Um, I'm partial to integrated treatment approaches. And I think for most people, integrated treatment gives them the best chances of not inadvertently making one worse. Right. So I see people in you know, in eating disorder recovery, who still talk about things that sound to me like food addiction, but their eating disorder is at rest. Um, I also see people who are abstinent in a food addiction way, who talk about experiencing all sorts of, body image dissatisfaction, body image distortions, um, maybe are overly restrictive in what they're eating, and don't really even want to touch it because that is better than what they were experiencing in the disease. So a lot of this is really needs to be like driven by what the patient wants and also listening to the patient's actual experience, and hearing it as their truth versus hearing it as, well, you don't want to touch the what I think might be overly restrictive because you're just a person with an eating disorder who's one of the poor souls that got tricked into believing that you have food addiction and that doesn't exist and now you have anorexia, right? Or atypical anorexia. So really truly listening to people's experiences of all facets of the illness and working with them on what they want to address and in what order. And I can share my clinical experience around trying to help people with both. But I think when I think about helping people, I think about sustainability. Like I want to help people find sustainable recoveries for themselves, and workable, practical solutions in their life. That's going to look different for somebody who's on SNAP benefits than somebody who's has like access to go buy fresh grains and vegetables and fruits and meats and fish at Whole Foods. So I think integrating care necessitates that I am not wed to an all or nothing dogmatic approach, whether I'm talking about food addiction recovery or eating disorder recovery. And it requires a blending of you know, juicing both fruits and coming up with like a mixed recovery cocktail. Um, and I think part of what's lacking in the eating disorder world is community support and peer support. We have, I think, a lot more of that in the addiction world. So helping people figure out which places they can get peer mentorship and be surround themselves with other people who are in recovery and doing things and living in ways that they might be able to adopt and borrow for their own good.